Hello, everyone, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria Stone-Ozbek, and tonight we have a very special guest. Tonight we have with us Dr. Heather Skanes, and she is an OB-GYN in Birmingham, Alabama. And tonight she is going to be talking to us about all things vagina, regarding the vagina, coming out of the vagina, going in, whatever, she's going to talk about all of that for us. So that she can help us as women have, the health that we deserve down below. Okay, so without further ado, please join me in welcoming Dr. Heather Skanes.
Hi.
Hello. Well, first, I just want to welcome you to the show. I'm so excited to have you on tonight. So to get started, tell us a little bit about who you are and what you do.
Yeah, so I'm originally from Birmingham. So I grew up here, then went away to go to school to undergrad and med school and residency until I came back 2 years ago. And I've been working in Alabama since that time, and have been working in women's health. And that was always my goal, was to work in women's health since I started medical school. So it's been an honor to continue that goal.
Yes, that is so exciting. And right quick, she is having her grand opening, you guys, on June 12th between 1 and 3 p.m. at the address listed on the screen, which is 401 Tuscaloosa Avenue Southwest, Birmingham, Alabama, 35211. So if you guys would like to come out and support her business, come out and get a tour of the office, I'm sure she would love to have you. So that's very exciting.
Yes. We want you to come out. I know a lot of people are very hesitant to switch OBGYN. Like, people are interested in having Black doctors and Black physicians, but they're very hesitant to switch from somebody that they're familiar with. So it's a great opportunity for you to come, see what the facility looks like, see what we have to offer. You get an opportunity to meet me and see if I'm the right physician for you.
Yes, and if you're like me, I love having a female physician. I don't know. It's just something about, having a woman there. I just feel like you can relate more to, the issues that we have, the symptoms that we experience, whether it's just going through basic, menstrual issues or, trying to conceive or pregnancy issues. I just feel like women, they can relate more to what we're going through.
Right. And then I think especially having a Black woman, because I think people don't realize how much brain energy it takes to kind of code switch, and you're focusing on saying things the right way rather than just saying what the problem is. And so having somebody who understands your language, so that you don't have to focus on, does this sound right? Or, whatever, you can just focus on whatever it is your issue is.
Yes. So let's just kind of jump right in. What are some of the common issues that you find that women typically kind of suffer with in practice? What is like something common that you see?
The most common things I see would be abnormal periods, vaginal discharge, of course, when people are pregnant, and then if people are having difficulty becoming pregnant. Those are kind of like my top 4 things. I mean, of course, other things like pelvic pain I see occasionally, but those have kind of been like the top 4 things that I end up seeing people for.
And so, okay, what was the first thing that you named?
Periods, abnormal periods.
So let's jump into that. What are some issues that you've been seeing with abnormal menstrual cycles?
So people, most of the time it's because people are bleeding too much. They're bleeding very, very heavily, and they are, it's interfering with their life. So that's very common. Of course, fibroids are very common in the African American community. But one of the other things that's prevalent that contributes to abnormal bleeding is poor nutritional status. So being overweight is a big factor in having abnormal periods. And so sometimes people don't like to talk about that because they feel like you're putting them down by saying, if you lose weight, your periods will start to regulate. But it's really true. There's lots of evidence that shows that a healthy weight will regulate your menstrual cycle. And so, like, just nutrition, talking about, things that you should be eating Sometimes people, don't like that one as much because it's not a pill, but
Right. Yep. They want like just something fast. Like,
right.
hey, just give me this so I could take it and just go on
Mhm.
by my, about my business. But
Yeah.
it don't work like that.
I mean, they can help. There's space for that, but
Yeah.
you know, if you could do this and then not have to take a pill every day, why not do this?
Well, Doc, we don't like to work, honey.
So yeah, that's very, very common. Every once in a while, I have people who come because they're not having a periods, and they're concerned, that something is wrong from that as
Yeah.
well. So
Yeah. And I know a lot of women that suffer with PCOS as
mhm.
well. I read an article that some people who have been diagnosed with PCOS may also be on the spectrum of having insulin issues or like pre-diabetic.
Yeah, so many people who have PCOS have insulin resistance. And so
Hmm.
typically when we have that diagnosis, we go ahead and check an A1C to make sure that you don't need to be started on any medications for diabetes or pre-diabetes. But yes, and insulin resistance definitely can be an issue in your overall health, but especially in those women who are coming to you because infertility is secondary to their PCOS. And so it's
Hmm.
like, this is something that we have to take serious. We want to get this under control so that you can have a happy, healthy pregnancy.
Yeah, absolutely. And also, you mentioned vaginal discharge, which I know that can come from a host of different things, whether it just be, bacterial vaginosis, or what are some things that you think that women do the most that contribute to those issues? Is
I
there like,
think that the biggest thing that people do is obsess about the smell of the vagina and what it's supposed to smell like. It's not supposed to smell like Bath and Body Works. It's not supposed to smell like flowers. You know what I mean? And so
yes,
because people have this misperception about what it's supposed to smell like, then they start doing unnecessary things which throw off their pH, and then you actually cause a bacterial vaginosis or a yeast infection because you're putting unnecessary things in your vagina. So
yes.
yeah, I think it's just a misperception. I mean, of course, sometimes you really do have an odor, so it's not to say that like you're making it up, but you have to know what is normal for you to smell
Hmm.
like.
Or why you have to kind
Mhm.
of get to the root cause of what's
Yeah,
causing the odor, because a lot of times it can just be like your partner, like
your
especially
partner, and also
yeah,
people not knowing how to clean themselves properly. And it's crazy to think that, but everybody doesn't have somebody to teach them that stuff,
yeah,
and sometimes it's amazing that you'll see somebody you're like, oh, they're, this old and they didn't know they're not supposed to wipe that way. They're supposed
right
to
back
wipe
to
completely.
front.
Yeah.
Don't do
I
that.
had adults say that to me.
Yeah.
Oh, I didn't know. Which way is it? So starting there at the root cause. Yeah.
Yeah, like front to back, y'all.
Yeah.
Front to back, not back to front, okay? Ah, and like you mentioned earlier too, a lot of people are having difficulty with trying to conceive. I've
Mhm.
been seeing that a lot in the Black community. I know, in particular, me and my husband right now are trying to conceive. So that has just kind of, well, one, he travels a lot for work, so
Mhm.
just kind of matching up your schedule with
Yes.
and all
Yes.
that stuff. So that's hectic in and of itself, but. I've been hearing a lot of women that are trying, but they are having issues, whether they think it's their issue with infertility, but it could also be the man. I think a
It
lot
can
of
be,
people
and
sleep
it's
on it.
usually, they kind of teach you that in school. It's usually like a third of the time it's female, a third of the time it's male, a third of the time it's a combination of factors. But a lot of times, when I start talking to people about ovulation, a lot of people don't know how to track their ovulation. So you may just be having intercourse at the wrong time. He put
Mhm.
abnormal periods. Yes, if you're not having a regular period, that's definitely going to make it hard for you to track
Mhm.
your ovulation. So it's going to make it difficult for you to become pregnant. So you got to start kind of with step one, like, are you having regular periods? Are you having regular intercourse? Um, those are kind of the basics. And we usually tell people to try for a year
Yes.
before you assume that you have a problem.
Yep. Someone said that they have known some women to take birth control to regulate their cycle. Is that a must?
It's definitely a reasonable treatment depending on what the issue is. Um, I mean, a lot of times we do give birth control for people who have like really, really heavy periods to help kind of regulate their menses. One thing that I have noticed is that you have to be really specific when you ask people about abnormal periods, because sometimes I'll say, "Do you have a regular period?" And they'll say, "No, it's not regular." And then I'll say, "Does it come every month?" "Yeah, it comes every month. It just doesn't come the same day every month." So technically you're within the realm of normal, but you think that something is wrong with your period, when it's not. There's nothing wrong.
Because it could be a 28-day cycle, it could be a
It could be
30-day
up to 35 days.
Yeah.
So, yeah.
Yeah. Someone asked, is there any way to stop a long cycle? So if you have it maybe like, I'm guessing about maybe 6 to 7 days or something like that. I know it's usually like 5 to 7.
Technically up to 7 days would be considered normal. So a lot of times if people telling me I'm having a long period, some people have a period that is like 2 weeks or like a month. Like I have bled every day this month. And when people come in with that, we usually do a workup. So one, I'm going to check and make sure that you don't have any vaginal infections, because when you have infections that are irritating to the cervix, that can cause you to bleed. Then we're going to check at an ultrasound and make sure that you don't have any fibroids or polyps or anything like that that may be causing you to bleed. Because if you do, simply removing that may take care of the long cycles that you're having. Mm-hmm. And then, of course, sometimes there's a hormonal imbalance. And then, like, as I mentioned before, sometimes just losing weight, 5 to 10% of your body weight, will regulate your menstrual cycles.
Yes. And you know what? So this is nothing that has been scientifically proven. Let me just put that out there. But I noticed that whenever I eat a lot of meat, like, beef or anything like that right before my cycle, I feel like my cramps are worse. And I also feel like my cycle is heavier. Mm-hmm. And I don't know what it is about and it's like, if I eat, like, just say if I eat nothing but fruits and veggies and stuff like that the week before, it's very light. It's very, like, I don't know. I can't explain it, but.
So now I'm on this journey to veganism. So I don't eat meat anymore because of the things that they put in meat, like excess hormones and things. And of course, it's going to affect your menstrual cycle. And so that's one of the reasons I don't eat meat.
Yeah, all the hormones, the antibiotics and stuff that they put into meat. So yeah, unless you're eating organic at Whole Foods all the time or going to the local butcher, honey.
No, really, what you put in your body is so important.
Yes. So Portia asked, isn't it a myth that fruit changes the taste of your vajayjay? You trying to drink some pineapple juice over there?
People swear by pineapples. I can't tell you. You would have to ask. I cannot tell you that, Portia. That's a great question, though. But because people swear by pineapples.
I know. What you trying to do over there, Portia? Oh, goodness. Oh, Lord. So, but yeah, I do hear that. But I also, when they say right before your baby is due, like if you want your contractions to come on, I've heard people say eat fresh pineapples or eat, certain fruits that will help to induce labor. But I don't know how,
It certainly won't hurt you.
So how do you feel about like prenatal massage and all that stuff? Like, do you feel that goes well with just basic prenatal care in your client?
I do. And that's one of the things that we have tried to create partnerships with people within the community who provide those services, who provide chiropractic services to people who are pregnant, who provide prenatal massages, prenatal yoga. Because when obviously you're growing a human inside of you, your body's going through lots and lots of changes. The shape of your spine is changing, your pelvic muscles, your pelvic bone structure is changing. Of course, you're going to be uncomfortable. And having those prenatal massages, doing prenatal yoga, all of that can be so helpful to deal with those discomforts.
Yes. And Dr. Taylor, she's a physical therapist. She said pelvic health physical therapy.
Yeah, absolutely.
And that is a big one because a lot of people don't really realize after giving birth
Oh, right.
how
Yeah.
important it
Changes.
is to strengthen that pelvic floor. You know what I mean? Or, that bladder will be dropping down.
No, very, very true. Very true.
So I'm glad to see guys are tuned in tonight because, not only is this information important for us, but it's also important for the men so that they can, be able to pass this information along to their wives or their girlfriends or their, daughters.
Right.
So just thank you guys for tuning in to the show tonight as well. Yes, honey, drop your information so they can
tell us where you are because I was looking for a Black pelvic floor therapist. I'm like, if you're in Alabama,
yes. Dr. Skanes, first of all, you about to make me drive all the way to Birmingham, okay?
Though it's been, I have just been so grateful for this community because people really come from everywhere. People have been coming from Tuscaloosa, Montgomery, come on. You deserve to feel comfortable with your provider.
Yes, absolutely. What are some suggestions that I know that you said exercising and to just kind of reduce the weight, but what are some things? So how do you feel about all this vaginal steaming that people are doing with the herbs and stuff like that? Is that something like that you kind of promote in the office, or what are your thoughts on that?
That's not something that I have in the office. I know I have a couple of friends who do that work. I have never personally done it, so I can't really say, much about it. I guess I'm one of those people that I'm like waiting for the evidence. I'm like, I want to see like a study, but I have definitely had patients who told me they felt like it made a difference. Now, on the flip side of that, I've seen people who did these self things at home and you leave stuff up in there. Like that's not what we're supposed to be doing. It's not.
Okay, so now that you say that, so are you referring to the yoni eggs?
Yes.
Okay. So what are your thoughts on the yoni eggs?
So, like I said, you're not supposed to be leaving stuff up in your vagina for like hours and hours and hours at a time. I mean, that's why tampons have warnings, because of, toxic shock syndrome and all of this stuff. So I'm like, I don't know. I will have to see more evidence on it. I'm not going to knock anybody who's ever tried it because I know that people can feel so discouraged by having like a vaginal odor or the feel that they have an odor or something like that. Like it can really be, something that affects their life and their ability to have, intercourse or feel comfortable with their partner. So definitely not going to knock you for trying it. But some of this stuff, like we got to really question whether this is helping you or not. If I think that if you were going to do it, definitely talk to somebody who does that professionally before you do that. Don't just buy something off Amazon. And
also too, I would try to make sure that you sanitize everything before just, putting it up there, because if it has any type of bacteria, which can come from your hand, it can come from, it just laying on whatever packaging it may be on. So you have to be very careful, what you're putting up there. So this is a big question because you hear mixed things about it. So in reference to douching after your menstrual cycle or after sex, what are your thoughts on that?
So you don't really need to douche.
Okay.
Do you need to clean yourself properly after you have sex? Yes, meaning like wash yourself, like take a bath. You don't need to douche. And especially you don't need to, because I know like a lot of people put like vinegar and stuff like that. You don't need to do that. You actually should not. Is
it harmful if you use vinegar?
Huh?
Is it harmful if you like?
Oh, it can be. It can be because a lot of times so what people will say is, I have to do this because I get really bad infections if I don't do this every week. It's like, no, you're giving yourself infections by
or drying
in your vagina. So you don't need to do that. you shouldn't do that.
And I think also too, if you're feeling that you have to do it every week, it's something else probably going on that you probably need to address, I think.
Absolutely. And a lot of times, it can be just as simple as taking a probiotic, to help get your pH, balance.
Yes. My life is so great. What are we gonna do with him? But I have heard of people also too, like well, I'm not gonna say people. I'm just gonna say well, yeah, I'm gonna say people. When you take a nice hot bath and just putting a little vinegar in the bath water instead of putting it up your vajayjay can help with
But you don't really need to do that. And that's the thing. I mean, if you're like, there's some people who are going to do it regardless because their grandma did it and whatever.
Yeah.
I mean, whatever. But you don't have to do that. All you have to do is take a regular bath.
Yes.
That's really all that you have to do.
Yes.
Is take a regular bath and wipe yourself.
Because it is a self,
it is a self-cleaning.
Yes. So let's see. Yes. Right. So another thing I wanted to talk about is the rate of mortality in Black women giving birth. So what have you kind of witnessed being in the medical field? I guess during your residencies, like, have you noticed a difference in how Black women were being treated in the medical setting versus other races?
So I have the privilege of training at Morehouse for residency. So it was the Black, and so Hispanic, and all of our patients Hispanic. So I feel like, of course, it was a different world, right? Because you have people who look like you who make up the majority of the hospital. Most of the nurses were Black, either African American or African. So because that was the majority of the hospital, I felt like I kind of got spoiled in residency. Now we were a low resource setting, meaning like you got to make stuff work. But as far as like how people were treated, like talking to people well and, doing the best you can for people, I felt like my residency program, I felt like we had good examples of that. Now, when I came back to Alabama, it has been very, very interesting. Just watching pregnancy care in general in Alabama. Of course, you're always going to see a discrepancy with, people of color, but just in general, I would say prenatal care and obstetrical care is so different. It's so, it's very C-section heavy here in Alabama, to the point where it's like, if you're not doing a C-section, they are upset with you. I also feel like, it's not very friendly to Black providers either. So of course it's not going to be, I can only imagine how I would feel as a patient birthing in Alabama, given my experience as a provider in Alabama. Like, they don't halfway want to listen to people with a medical degree. So if you're a patient and you're trying to advocate for yourself, I can imagine the frustration for sure.
Yeah, definitely. Because I don't know what it is about when a Black person complains of being in pain. I feel like it's kind of brushed off to the side. Like, you hear stories of like Serena Williams, being in pain and complaining to the doctors about, not feeling well and stuff like that. And to find out she had like a blood clot. And so, when you hear stories like that, it almost kind of makes you fearful to even want to give birth in a hospital setting, because you just don't know, what's going to happen, or if your doctor is really going to be the advocate that you need them to be for you.
I think it can definitely be hard. I think it goes back to speaking the same language, though. Like, you really have to ask the right questions to get the information from people, because, if I say things a certain way and you just like, like, I might have a patient that just says like, I just don't feel right. Like, they might just say that. And if you don't care, you're not going to ask any follow-up questions about that. Right? Like, if you don't care about people of color, you're going to say, oh, she said she don't feel good, whatever. Next, you have to delve into like, what specifically is hurting you. Are you in pain? Do you feel like you can't breathe? And some people require that amount of detailed questioning in order for you to get to the bottom of what it is. And people don't want to do that. It's just easier to just assume that they're putting on.
Yeah.
But really what ends up getting, with women of color is hypertensive disorders. That's really what ends up being what gets us preeclampsia, eclampsia, strokes from uncontrolled blood pressure, postpartum cardiomyopathy. Those types of things end up being what gets us.
What do you think that's kind of in relation to? Is it more so diet, or is it just like stress, or just a combination of both?
I mean, I think we are living in a very high stress environment, in a very high stress time as a woman of color. So I think that definitely plays a role into it. I think, of course, living in Alabama diet is not the best. So I definitely think that contributes to it. Obesity and just like not eating the right things. And it's really because people don't take the time in their prenatal visits to talk about what you can and cannot eat. People don't spend a lot of time on preventative medicine. So a lot of times I might spend, time talking about, hey, as a woman of color, you may be at increased risk for hypertension. So maybe you should just go ahead and start you on a low sodium diet. Let's talk about what foods have a lot of sodium in them. Let's talk about how you're eating right now. Do you eat out a lot? Like, spending that time to kind of talk about it, because people don't necessarily know what to eat. And if you're busy and you're working and you have other children, if you got to find this stuff yourself, you may not do it.
Yeah. And it's all about managing our time and stuff better,
Mm-hmm.
because a lot of times, you'll hear people say like, oh, well, I don't have time. But
Right.
It's kind of like one of those things where we have to make time for ourselves, like our health, like that's really all we have, is our health. So,
and really just trying to optimize your health prior to pregnancy, it's kind of hard when we're on the back end trying to manage stuff that really should have been taken care of before. I think that, trying to, like, when you say I'm trying to get pregnant, that's when I'm going to try to make these lifestyle changes so that I can have a low risk, pregnancy.
Yeah, absolutely. Lawrence said that his daughter is more than likely going to be an early bloomer. So what are some things that he should look out for other than mood swings?
So I think that talking to them about what a normal menstrual cycle is, what the menstrual cycle is for, like, what is a cycle? Why are you bleeding every month? You're not dirty. You're not, there's nothing wrong with you, that this is something that's normal and that it's something that's okay to talk to you about. I think that would be so important to her, to be able to say something's not right, because some of these problems start kind of early and then, they don't say anything for several years. But, when you have a daughter saying, hey, bleeding is normal for you, it should occur every month, the first 2 to 3 years of the menstrual cycle may be a little bit more irregular, meaning the length may be a little bit irregular, the timing may be a little bit more irregular. But there's nothing inherently wrong with you, that this is nothing for you to be embarrassed about. Nobody should be making you feel ashamed of this. Having the conversation about, when you start having a period, this is what you're going to do. So, these are what pads are for. This is what a pad looks like. When you, experience that, this is where your things will be. and letting them know. I mean, because a lot of times we just don't talk about what it means or what it's for. And so a lot of people think that it's something dirty, and it's not.
Yeah. I think I gave my daughter the talk. I started giving her the talk around like 7 or 8. It was just kind of like, but it was more like subtle, like if you ever see, bleeding or anything like that in your underwear, it's okay. Don't be alarmed. You're not about to die, like don't panic. So I just kind of, led the conversation with that. And when she first, even though we had the conversation, I felt like we were prepared. And when it finally happened, I ran to like Walgreens, and I think I got like so many different varieties. I'm like, what do you want to wear?
Yeah.
And so that was interesting. So I can only imagine how the dad is going to be.
Right. I mean, the other thing that you're going to expect, of course, talking about the fact that, now that you're having your menstrual cycle, you're going to develop, like you're going to start seeing breast development. You're going to start getting hair under your arms and this air in your pubic area. Like those are normal things. And then talking about that, I mean, the pain part of having a period may be a little bit disarming when you're young and have a period. I mean, I was a little bit older. I was like 14, so I kind of knew. But if you're like 9 and you start having pain, you may think that you're about to die.
Oh, yeah.
That sometimes, cramping happens, and, talking to her about that.
Lawrence. Heating pad.
I know people think, like mood swings, but some people do have mood disorders that are around their periods, but sometimes that is really just the pain talking. And so that's something that you might want to ask, like if you notice a little change, and was like, are you feeling okay? That type of thing. So I know
you're a little bit more irritable, it's just like, I feel like crap, so I want to be nice to you.
I do. And people have other symptoms, like bloating, nausea, that people feel ill. So
yeah, it's like nothing.
Lawrence, that's a lot, but
I know. So get ready. So you got a lot to look forward to. But all in all, and also too, if you didn't have the sex talk, I think that that's kind of a good way to kind of open up the sex talk with them and let them know that if you do have sex, it is a possibility that you can get pregnant now that you are starting to have menstrual cycles. So I think that that's very important.
Breast hair. Okay, so
you probably do. Yeah.
But no, I mean, and I think that's important though, because I know it might be scary as a dad, but especially if she's very young and she's starting to develop, she's going to get some unwarranted attention. So that's also something that you might have to find out the best way to kind of address that. Like, these grown men should not be talking to you. You are still a child.
Yeah.
Don't let no grown man come tell you that anything about your body. Like, so I think that that's the other aspect. Like you can't be too careful when having these conversations with your kids.
Yeah, and perverts, they don't care if the child develop or not develop, So let's see what else we got out there. So what are some other things that you see in practice? Like I know someone asked about was it birth control to try to kind of help regulate their menstrual cycle? But have you noticed an increase in women having strokes that were on birth control?
I wouldn't say it's uncommon. It can happen, of course. And that's kind of something that I talk to everybody about when we put them on estrogen containing birth controls, the risk of blood clots and stroke. But if that's something that really concerns you, like say if you're someone who has a family history of strokes or clots or whatever, there are non-hormonal and non-estrogen containing birth controls. So there is a birth control mechanism for everybody, right? There's non-hormonal. There is non-estrogen containing, there are barrier methods, there are, timing, ovulation, ovulation tracking and all that. So don't think that you don't have any options as far as birth control goes because of that. You do. There's lots of ways.
Yes, so that was going to be my next question about the people who don't want to conceive. Um, I guess I know everything is based off that individual person, but if we could just briefly just talk about what are some of the options that they have from birth control. I know um, there are so many different
Yes,
kinds,
there's
but
so
we
many
could
birth
just maybe
control.
touch on um, the different ones that are out there. I
Mhm.
know they have the Mirena, like you can insert up there. They have one you can put in your, is it in your arm or
Mhm.
something like that?
So a lot of times, when we're talking about birth control, it's so important to discuss your individual goal. Is your goal to not get pregnant this year, or is your goal to not get pregnant for several years or ever again? So, you know, that's kind of how we choose the best birth control method for you. Of course, the most effective form of birth controls are, aside from having like permanent sterilization, would be the long acting reversibles, which are IUDs and the Nexplanon, which goes in your arm. So those are the most effective form. Those are the ones that you get placed and you don't have to remember them anymore until it's time to have them removed. 3 to 4 years for the Nexplanon, and 3 to 10 years depending on which IUD you choose.
Okay.
And
And
then
um,
you,
oh no, go on. I'm sorry.
of course, there's the depot shot. People are pretty familiar with the shot that but you have to remember to come back every 3 months. And then, people are pretty familiar with the pill. There's different types of pill. There's the estrogen containing pills, and then there's the non-estrogen containing pills, which both of those, so you have to remember to take every day.
And then I hear a lot of older young women that when they don't want to have kids anymore, they get their tubes tied or burned off. Do you guys actually burn the tubes when you try to like keep people from like
Right.
how
hmm
does that process work?
So there's a lots of different techniques to do permanent sterilization. So you can either remove a segment of the tube. So you can remove a 3 centimeter segment. You can burn a 3 centimeter segment, just burn it along the lines. I typically remove the whole tube. So I usually try to make sure people are very, very sure. I'm like, once I remove this tube, it's no putting it back together.
Right.
Right.
That's
So it's gone. So that is called a salpingectomy. And the reason
Mhm.
that I choose to remove as much of the tube as possible is because there has been a link between ovarian cancers starting in the fallopian tubes. So you can decrease your risk of ovarian cancer by removing the fallopian tubes.
Wow.
And since we don't have any effective screening for ovarian cancer, if you're going to get your tubes tied or a hysterectomy, then the recommendation is to remove the tubes.
Nice. And another thing I want to ask about is, so I know they recommend a breast exam at the age of 40 for your mammogram,
hmm
right? But if you were in your, like me, I'm 35, if I want to get a breast exam done, would I have to get a referral from my OBGYN or how would that work? Because I
So
have,
typically we do your a breast exam, like a manual exam, during your annual GYN visit, regardless of your age.
right.
If we're going to do an exam at all, right? So we would go ahead and do that. There's some people who are super young who I wouldn't do an exam on. They're 16, they're just coming in here for the birth, so I might
Mhm.
not do a breast exam on them. But if you're 30, we would start doing your breast exam.
Mhm.
There's different recommendations regarding when to start mammograms. 40 versus 50 versus doing risk-based screening. And so if you are somebody who's not 40 yet, so most insurance will pay at 40.
Mhm.
If you're not 40 yet, but you have a family history or some other risk factor, then you can get it ordered and we can go ahead and do it and get the insurance to pay for it. If you don't have any risk factors and you wanted to just have a mammogram, you probably could get it done, but you might have to pay out of pocket. Your insurance might not cover it.
Okay. And I've been seeing more people do thermography versus a mammogram.
hmm
Like, do you notice I guess, what is the word I'm looking for? Is there a difference in the two? Like, some people say that thermography is a little bit more sensitive than
Mhm.
mammograms, but
So
have you?
right now, the standard of care is still a mammogram.
Okay.
So that's what we're doing right now. And then, of course, if anything comes back abnormal on the mammogram, you can get a more advanced testing depending on what the radiologist recommends. Sometimes they recommend an MRI, sometimes they recommend ultrasounds of the breasts, depending on what they think is going to be the best to see what they need to see. But just going to put also out there that I have partnered with UAB, who is doing the Wisdom study right now. And this is a study that is for women ages 45 and older, 40 and older, to determine what is the best method to screen for breast cancer. And they asked me to be a partner because they know that my clinic is specifically targeted towards women of color, and we need women of color to participate in order to get the information. The reason that I agreed to participate is because this is not like a regular clinical study where they're going to decide things for you. You actually get to decide which arm of the study that you want to be in. And I think that's very important that we as Black women aren't misused in studies. And so in this, you have the option of getting a routine mammogram, your yearly mammogram, versus doing risk-based screening. So they can do genetic testing for you. And then based on your genetic testing, they would put you on a pathway for what screening that you would do. But it's your choice, which one. The reason, we just need the data for people of color to make sure that whatever recommendation they make is applicable to women of color. So it is important for us to be a part of these studies so that we can make sure that, whatever guidelines that are created in the medical field are applicable to our population, right? But I don't want women of color being taken advantage of and used as test dummies. And so that's why I was very hesitant until I spoke with them and got more details about the study. And you do get to choose. And so, that's one of the things that I do offer to people. Of course, you can say no, and there's no repercussions for you choosing not to be a part of that study. But it is a study that's going on here in Birmingham and in several other major cities throughout the country.
Yeah, because I am noticing more women in their early 30s, being diagnosed with breast cancer. So, real quick,
Mhm.
what is a proper way to give yourself a self breast examination in the shower?
So, there's lots of controversy about the self breast exams versus what they call breast awareness, because people would find things that weren't necessarily anything. So what you really want to do is you have to lift your arm, of course, when you take your shower, but you really want to start at your clavicle and you're going to go all the way down your breast to the beneath the base of the breast. And you want to feel kind of like in a circular motion. And basically what you're looking for is, what does your normal breast feel like?
Mm-hmm.
You want to know what your baseline is. And that way, when something abnormal occurs, you can say, no, I know this is different. Versus if you have a lump or bump that's been there, 6 years, likely it's benign. But we need to know that, like, this is something that just popped up. But of course, you should be getting your annual breast exam with your primary care or your OB/GYN doctor. But yeah, so there's kind of controversy about whether we should be recommending monthly, self breast exams, which they were pushing very heavily for a time, versus just doing kind of breast awareness, knowing what your normal breast feels like. Doesn't mean you have to do it every month, but just knowing that, what changes your breast may be having, even just skin changes, knowing what your skin looks like. Because that, there are types of breast cancer that are just inflammatory and they look like, infections, and it's actually a breast cancer. So you need to know, like, what your skin looks like, what your nipple looks like. Is there discharge coming that should not be coming? If you're not breastfeeding, you really should not be having anything coming out of your breasts. So those are things to kind of monitor for.
Absolutely. Well, you know what? Do you have any kind of closing remarks that you kind of want to leave the viewers with? Something that can just kind of take away and utilize in the future?
I guess just, thank you guys for having me and spending this time with me. We look forward to seeing, let people know that we're out here in the community. We're providing evidence-based care and with a goal of ending reproductive health disparities. We're located in Birmingham, but you can come from anywhere in Alabama and be seen and know that you're going to be loved and treated with care.
Absolutely. Well, thank you guys so much for tuning in, and thank you, Dr. Skanes, for coming on the show. I think that we have blessed them with a lot of knowledge tonight, so I'm very excited about that. You guys, please do not forget, if you are in the Birmingham area, her grand opening is June 12th from 1 to 3, okay? The address is on the screen. Do not forget it. Do not miss it, because I know a lot of y'all looking for a new OB-GYN.
And you didn't get your exam last year because of COVID. Come on in, get your exam.
Yes, come on in, honey. Get checked. Get the JJs checked. Okay. Well, thank you again for coming, and you guys be sure to tune in every Monday night at 7 p.m. Central Standard Time, Random Health-ish. We stream live on YouTube and Facebook. Be sure to like and subscribe to our channel, and make sure you share this video, because the information in this video can definitely help someone. So thank you and good night.
Good night.